Hi guys, my name is Janet, and my current event is on an article called "In Southern Colorado, a technology-driven initiative is helping to fill in the gaps for underserved patients." This article was written by Heather Landy in 2018 and retrieved from healthcareinformatics.com. This article discusses how a coalition called Community Health Partnership led to the development of an infrastructure to improve communication between primary care, mental health, and social service providers across 3 separate organizations in southern Colorado. In order to improve communication and data exchange, in 2015, CHP partnered with CoreHio to connect these providers to the Health Information Exchange Network. Ultimately, CHP was able to build bridges between 38 different EHR systems and a total of 40 providers in the community of southern Colorado. The success of this infrastructure has now allowed for bidirectional data exchange. In addition, providers now have faster and complete access to their patients' critical health information. This leads to better patient treatment plans, it reduces treatment delays, and it eliminates unnecessary testing. Communication between Medicaid and the providers has also improved. Before the program, it would take 3 months before patient information was obtained for a Medicaid claim. Now the information is received in real time. The next step for CHP is to implement a program called Client Track, a care coordination platform. This program combines the patient's historical data and real-time clinical data in one location, allowing care coordination or care coordinators to look at the information and take instant action. A great example is when an undeserved patient is admitted into the ER. The primary provider can be notified instantly to ensure that the patient has transportation. Similarly, soup kitchens have a lot of patient information but lack the technology. With Client Track, if someone logs his or her name into the soup kitchen, the care coordinator could be notified about this client. The goal is to manage the factors that impact a person's life that could eventually affect their health as well. There are several implications that organizations may face when attempting to improve interoperability via HIE. Cost is a huge factor. Without proper funding, smaller organizations may not be able to afford this project. The organizations may also lack the IT staff to develop and sustain a data sharing infrastructure. In addition, potential privacy and security issues can arise with patient information being shared in the HIE network. This article is important to my profession because nursing is about rendering holistic patient care. A data sharing infrastructure program will improve communication not only between clinical providers but also incorporate social services. Presently, many hospitals in primary care only treat medical conditions. However, social and mental stressors can also contribute to a decline in health. Improved communication between providers can improve overall care of the patient. So that's the end of my current event. Thank you for listening.